All right, so good afternoon, everyone. For those of you joining us for the first time today, welcome to Howard's 2020 Homecoming Conference. And for those of us who attended one of the sessions this morning, welcome back. A few things to note before I turn the session over to our moderator, Dr. Linda Jones. For the panelists, you've been given full access to the webinar, so you can share your screens with us if you have slides or media to accompany your presentations. You can also use the polling option if you need to. For audience members, please keep in mind that the chat will be turned off during this session, but the Q&A will be open. So feel free to ask questions there, and our moderator will make sure that the panelists answer as many of them as possible during the time that we have. And with that, I'll turn it over to you, Dr. Jones.
Good afternoon, everyone, panelists and attendees. The radio talk activist Joe Madison often talks about the difference between a moment versus a movement to his listeners. When he interacts with his callers, he normally ends with, "What are you going to do about it?" We have three panelists who are bringing to your attention much needed investigations into their areas of expertise in media policy, housing affordability, and medical sociology. All three of these areas have consequences to the least served. Media unfettered ownership controls the messages that are often stereotypical and biased information that does not serve people of color well. Health disparities is evident under this current COVID-19 pandemic as it adversely affects African American and the Latinx populations. Affordable housing in the era of gentrification is problematic, and under a pandemic, the repercussions are alarming. It gives me pleasure to introduce each of the panelists. Before I begin the introductions, well, first of all, I believe the person who's the housekeeping matters have been handled. So without further ado, I would like to start presenting the panelists. Apologize for my computer. Jordan Lindsey is a doctoral student in the Communication, Culture, and Media Studies program in the Kathy Hughes School of Communications, but he is a graduate student in the graduate school PhD program. With an undergraduate degree in the humanities and a Master of Science in Comparative Public Policy, his research centers the intersections of social identity dimensions, policy, and communications and their implications for larger societal structures. Focused primarily on the information and communication technology sector, his research interests include policy narrative, public interest debates in communication, comparative and international communication research, and regulatory policy. Bethel Cole-Smith is a PhD student in economics. She studies housing, focusing on topics of affordability and gentrification. Her dissertation examines the impact of 3 DC government home ownership programs on housing affordability in DC. Bethel is a past Institute for Research on Poverty dissertation fellow and is a current Just Julian fellow. Marie Plaisime is a PhD candidate in medical sociology at Howard University, of course, studying the impact of medical curricula and training on reducing provider racial bias. She received a Master's of Public Health from Drexel School of Public Health, and her academic work focuses on the relationship between racism, multiple forms of discrimination, bioethics, and health policy. Marie is an RWJF Health Policy Research Scholar and a Howard University Just Julian Graduate Research Scholar. Her essays and research have been published in the Lancet Journal of Racial and Ethnic Health Disparities, the American Journal of Orthopsychiatry, and the NIH Record, among other outlets. And the RWJF stands for the Robert Woods Foundation. Without further ado, I would like Lindsey to start off with a background about his research.
Thank you, Dr. Jones. Hello, good afternoon, everyone. So kind of as Dr. Jones said, my research centralizes the role of communication and discourse. Most often I look at the communication policy sector. A lot of times I like to just summarize it as communication of policy and communication policy. most recently, I looked particularly at T-Mobile, the T-Mobile Sprint merger, and then diversity in media ownership, particularly in the way that public interest is framed in these policy debates. So looking critically at how regulatory policy shifts the way that we see public interest.
Thank you. Now we will hear from Bethel. Yes. Hi, we would like to hear from you, Bethel. Will you please share your research with us?
Sure. So I am doing research on housing. My housing research is focused on the District of Columbia, and it's looking at 3 programs, the HPAP, EAHP, and IZ, which is inclusionary zoning, which look at making housing affordable in the District of Columbia. We've seen a 10-year increase in 63% of housing prices across the DC area. We've had changing racial composition. For example, in 1980, we had 70% of DC's population was Black. We have a falling share of that Black population. And my research is looking to kind of see whether these policies that the DC government implemented, which aim to address income segregation as well as racial segregation, whether they have their goals, their stated goals. So more generally, housing is something that affects everyone. And so my specific focus is the DC area.
Thank you. We'd like to hear from Marie now to give us a summary of her research.
Great. I have prepared some slides, so I will just show those very quickly. It says that the host has disabled screening. Thank you. Okay. Again, my name is Marie. I'm a PhD candidate in the Department of Sociology, and my research looks at how we can improve health policy and medical education so that we can better treat patients. And so just really quickly to get folks oriented in the work that I do, we know that within the United States, there's a rich history of racial discrimination and segregation. And my work looks at how, in ways, racism impacts Black and Brown patients within the clinical encounter. And so from the literature, we know that Black patients are less likely to receive certain cardiovascular procedures, receive substandard care in kidney transplants, cancer prescriptions, and medication. And so while much of the literature has focused on patient outcomes, my work focuses on the provider's perspective. And so by looking at the intersection of racism and healthcare, we can begin to see the ways in which racism and bias impact healthcare delivery between clinicians and the folks that they work with. And so in 2017, this kind of started my work in policy and thinking about the ways medical students are trained. I conducted a qualitative study with folks at the University of Pennsylvania and Drexel in Philadelphia, where we conducted qualitative interviews with medical students, providers, and nurses. What we found was that both Black and white providers described Black men as less educated, violent, and not able to follow through. And so when we think about the ways that folks are trained in medical school, it leads us to think about the ways in which you can improve policies and practices. And so I just wanted to highlight really quickly one of the most important questions from that study and thinking about policies. Can you think of a time when you or another provider or a colleague treated a Black patient differently? And highlighting what Anna said, a white medical student said, it's the sense of comfort. I feel like I'm more able to give white patients advice. I feel like I understand where they're coming from. It's harder for me to walk into someone's room who's different from me. If the patient is from a white upper middle class family, then I feel like I pretty much understand what's going on at home. And in that study, we found that Anna and a lot of the white providers were not alone, and they felt a sense of discomfort. And so that led me to my work that I'm doing at Howard, thinking about the ways medical students are trained. And so for my dissertation, I'm doing longitudinal analysis and examining data from medical students across the United States and asking them questions about the policies that exist in medical school to address bias.
Thank you. So this question is for all. I'm sorry, you're not done.
No, that was done.
This question is for all three of you because I understand when we're conducting research, that is a passion for us. And sometimes it is informed by our lived experiences. So tell me about some of your personal experiences that attracted you to this research.
I can go first. So I was thinking, at least for me, I kind of grew up in a household that strongly emphasized the power of language through religion and also its importance to race and discussing race. And so I think initially, as a child and growing up, I was very interested in the creative arts and how creative language was part of that, which is why I studied humanities in undergraduate. And in college, I kind of realized through personal experience and, in academia that language also is very important for policy and very things that I had originally saw as being separate from the creative world. And now essentially that's kind of brought me to where I am, where, narratives, false narratives like the war on drugs or black on black crime, black on black violence, are things of particular interest that motivated me to look at how language and how we frame and talk about these policy issues can affect, minorities or any other sort of marginalized group or nations and things like that.
Thank you. Bethel?
For me, I grew up in Jamaica with a front yard and a backyard and had many great experiences there. But then I think back to my grandfather, who at the age of 12 was kicked out of the home he was living in just because of inability to pay. And that kind of, made me really think about housing and the impact that it has. He had to move across the country at that time and try to figure out a life for himself at the age of 12. And so knowing, it was a different context, but knowing that, because of race and because of historic practices that still have impacts today, such as redlining, such as the types of loans, predatory loans, as well as, not getting access to certain types of loans. These kinds of things affect where people, and especially Black and brown persons, persons of lower income, are able to live. And home affects your trajectory for life. It affects the kind of amenities you have access to in a neighborhood. It affects your school district. Just all of those things being affected by where you live. That kind of drew me to this area of research on housing and on gentrification, on displacement, because it has such an impact on the whole trajectory of your life.
Thank you. I'd like to hear from Marie now.
Yeah, for me, I think my experiences stem from being the daughter of Haitian immigrants and having to navigate the healthcare system with my parents, whether that meant reading documents for them at an early age or translating within that encounter with the provider, making things clear to my parents. And I saw how different providers treated my parents or different family members based off of their accent or the way that they looked, right? And so I knew from an early age that social factors such as race and class and gender played a role within the clinical encounter. And that's kind of just been the crutch of where I do my work now.
Thank you. So if you, so right now, okay, we're looking at communication, and we're looking at ownership, for instance, Rupert Murdoch, and the fact that his his messages reach 90% of the world. So that's a person who's pretty powerful. And we're looking at gentrification, which is happening all over this country. And we're, of course, health disparities, that is throughout the entire country as well. So if we stay on this trajectory without any type of intervention, where do you think we're going to be probably in another 3 or 4 years?
I think, I'm sorry, Doctor.
Go ahead.
I think that currently the media environment is already pretty concentrated, which I think is a major problem. If it continues, the main things that I think will be something that we have to address is how these telecommunications providers, or even including companies like Amazon, Google, Apple, Facebook, how this concentrated power threatens the health of our democracy. And then how, when we think about things like the public interest, right? Like how the public is being hurt by it being framed for these private interests or these kind of special groups, as opposed to what we would hope would be more inclusive, especially for low income, already marginalized communities, for things like livelihood, our housing, or even health.
So with I'm going to continue with you right now, Jordan. So with the fairness doctrine and the fact that the deregulation of the media actually started in '87 under the Reagan administration, do you think requiring balanced information and balanced opinions would work with Facebook, Twitter, and the new platforms that we have now?
I think that having the idea of having a balanced diversity exposure of content and things like that is a very important issue. It kind of comes into the whole content diversity problem, which a lot of sort of private or economically focused perspectives might focus on how there is a diversity of content, but kind of like you brought up, a lot of people can only focus on one aspect of that content. So
Right.
Diversity of exposure to the content is also just as important. And so in that way, yes, I absolutely think that that's an important thing that should be included.
Okay, thank you. Bethel?
So in terms of continuing on this trajectory, we already have a housing crisis going on especially the coasts of the country. DC has been having, as I mentioned, rising housing prices. And if we continue on this trajectory, it will only get worse. It's not just affecting lower income populations, it's creeping up the income scale. So middle income families, there was a report that, to be eligible for certain types of low income benefits, the threshold, even $100,000, is a bit hard in terms of being able to get a home and to qualify for certain things. And if you think of the context of the whole country, 100,000 seems like such a high threshold. But in this specific metro context, it doesn't go as far as you would think. And so continuing on this trajectory would just make it exponentially more unaffordable. And in terms of ways that people have been coping or dealing with it, people are having to double up on their living arrangements. People are having to make difficult decisions to cut back in terms of, food, in terms of being able to take on certain medical expenses, delaying even their health. For things like being able to afford their housing. And so it's definitely something that we need to dive into and make a change, because it just continues to get more untenable situation.
I remember when the Ward 8 councilman, they were building a new development in Southeastern Ward 8. And the councilman, when he found out that the affordable housing, I would say threshold was $90,000, he stopped construction right away. So in your mind, based on the median income in some of these wards, what would be considered the ideal salary for a family of 4 for affordable housing in Washington, D.C.? I would say Ward 8 and then maybe Ward 1.
In terms of an ideal housing income to qualify or to be able to purchase?
to qualify?
So, I think maybe, you know, looking at kind of like that report you mentioned, in terms of being able to qualify for those, we should definitely have probably say definitely a lower threshold in terms of say 80 or something that they could qualify to be able to get into these programs. And I think it's also looking at a number of things, because as you mentioned, the number of persons in the household makes a difference. One person at one income versus a family of four on the same income, those things definitely need to be taken into consideration. And that is definitely something that is taken in consideration in some jurisdictions, but it's not necessarily fully adopted in terms of taking the household size into account.
Thank you. Marie, if we continued on the trajectory in health disparity with the research that you're doing, what do you think the outcomes will be within 5 or 10 years?
Mm-hmm. Well, we know within the United States, the population itself is becoming increasingly diverse, and the workforce itself is not. We actually see a steady decline in folks entering the medical workforce. And just looking at stats, right, within the United States, 1 in 5 children are born into poverty. We see lots of bias in treatment of Black women and pregnancy outcomes. Again, when I highlighted in my presentation that Black men are less likely to receive substandard, or more likely to receive substandard care. And COVID-19 itself right now has highlighted how structural racism determines who lives and who dies. And so if we are to look at training policies in medical school, we can really start to target a point of intervention where we can have upstream better consequences.
You know what I found really alarming, Marie, was the recent research project that was revealed to us maybe about a month ago. And we already were informed that African American newborn children had a higher mortality rate, but to find out that it's a lot of it was determined by whether your physician was white or Black, when it came to not only just the mortality of newborns, but the mortality of the mothers themselves. Mm-hmm. What do you like to add to that?
Yeah, so a lot of that research has been widely studied, and now it's sadly picking up steam now. But racial concordance, whether or not you have a Black physician, does play a role. There's certain factors when you're talking with your provider that you maybe feel more comfortable, you feel like your needs are met. And so if we can, one, diversify the workforce and desegregate healthcare services, we can think about how to improve outcomes such as in maternal care.
Thank you. I'll start with you, Marie. You hang on. If you had more resources, time and funding, what else would you investigate?
Oh, wow. So there's a number of things. I'm also interested in not just how race, but how gender, how language plays a role too within the clinical encounter. Being a daughter of immigrants and thinking about the ways how Caribbean American children navigate the healthcare system. I would love to do some sort of study like that, and looking at the ways how we experience healthcare services different from others.
Okay. I would like to ask that question to Bethel as well.
So for me, I would love to expand my research in terms of looking at the entire DC metro area. Right now, my work is a little bit more directly in the DC district limits, working with DC government data. However, it's a whole job and housing market, and it extends a lot further than just the bounds of DC, and I would love to be able to incorporate that data and get a broader view.
Thank you. How about you, Jordan?
I'm very interested in kind of more recent literature that engages in how a lot of these corporations now are very mixed media, and so categorizing them for regulation purposes and things like that is very complicated. There's literature that looks at platformization. So even thinking about how social media platforms like Twitter or Facebook operate as a platform for people to speak from, but also as broadcasters, and how sort of framing companies as platforms can also sometimes take away the responsibility, the social responsibility that they have as broadcasters.
Thank you. Well, you hang on. Why don't you describe some of your policy solutions and who would you present those to?
So the Federal Communications Commission would be the primary regulatory body that I would discuss with, maybe even the Federal Trade Commission. But I think of major importance for the FCC policy-wise is establishing some definitions that have yet to be established by the Commission. One of those is a clear definition for diversity, because they provide categories of diversity, but since there's no explicit definition yet, it's a lot harder to argue for minority ownership because the definitions aren't quite there. And then the same kind of goes for public interest, like I brought up. The FCC does not give a clear definition of public interest. And while the public interest is not a simple thing to define, it's difficult to show the leaning in, liberal utilitarian perspectives of the public interest that focus more on the public as consumers or something like that, rather than maybe citizen or democratic focused definitions of public interest. So mainly policy that clearly states at least what the public interest is or what diversity is, so that more policy decisions can be made clearly in the future.
Thank you. Bethel?
In terms of policy, I would love to present it. There's a number of different housing authorities, excuse me, a number of different housing groups within the DC government, but I think it's important to look not just on those focusing on affordable housing, but more broadly in terms of also the financing of housing, because they definitely go hand in hand. So that's key to being able to provide this additional housing, both specifically for the lower income population, but as well as a broader population, because the housing affordability crisis is affecting all parts. And then in terms of some specific policies, in terms of increasing the supply generally, I would look at changing some zoning regulations with so much of DC is land constrained, so it's definitely a small space. And with just single family home zoning on certain parts, it becomes difficult to have enough housing for everyone. So I would definitely look at zoning regulation. I would also look at inclusionary zoning. The district has an inclusionary zoning program that has been doing well. However, it's small, so definitely I would look at expanding that program, which is important for helping to deconcentrate poverty and to allow access to different types of neighborhood amenities for persons who otherwise would not have such access. And I think even this research I'm doing in looking at these three policies that are already enacted would help to understand what parts of the policy are working and what parts are not, because one of the stated goals in these three particular programs was to improve racial integration. As we all know, there is racial segregation within the housing space, and so to look and do a systematic study on the impact of such programs, I think, and having more generally regular evaluations of such programs, I think that is definitely important. To mention just one or two more, there are certain tax credits for long time residents and for persons who live in their own home. And I think that's, definitely something important, but also to look at it, basically to make sure it's as targeted as possible so that the intended population is able to make the best of it, and we don't necessarily, have too many businesses or corporations, not to say taking advantage, but something that we wanted for these populations that they can benefit fully from it.
I have a question for you. Do you think if you tied that into programs for employment and to retool job skill sets and so forth, that if you would be able to sell it better?
That is such a pivotal and important aspect, because having the income to be able to pay for that housing, that's a critical component. Even myself and my sister were discussing it, the fact that prices are going up, but having that to be able to pay for it, because even some people, they have a paid off home, the home is fully paid off, but it's to be able to make that tax payment, and it's the tax payment that causes them to lose that home. So jobs and having access to jobs is extremely important, and I think that aspect should be a part of it, because it's something that helps on both sides, because people want to be able to have that job to be able to provide for themselves in that way, and to upskill in terms of what they're able to provide for themselves, and that will help in terms of changing the tide on people having to move out of their neighborhoods. So definitely.
Thank you. Marie, I have the same question for you regarding policy solutions, and who would you present them to?
Well, I think there's a lot of, given the current political climate, there's a lot of folks who would be interested in this, and so I'd really love the opportunity to pinch it to policymakers who have a role in shaping healthcare services and medical organizations such as the AAMC. And my specific policy would be aimed into creating anti-racist curricula within medical schools. Right now, cultural competency training isn't standardized, and so not all schools are required to learn about different cultures. And so if we take that one step alone by standardizing curricula and desegregating the services that folks receive, we can really make a huge impact, really, in education and housing and communication that my colleagues just talked about now. And so if we take the time to invest money into resources early on, we can really see a huge impact later.
Thank you. We're going to stay with you. Now you've heard your fellow panelists, and you hear the research they're doing. Do you see any opportunities for collaboration on future research with the other two? And if you do, please explain.
Absolutely. I know I'm going through a lot of stats, but the United States spends $20 billion every year on medical errors, and 4% of that is related to mistakes related to race. And so if we could create sort of an interdisciplinary project where we look at housing and we look at communication, the ways folks receive information, we could really have an impact in the ways in which providers interact with their patients.
Thank you. How about you, Bethel?
Definitely see room for collaboration. I think if you think about housing and the impact that it has, there's also a large literature on the impact of housing and health. And even in terms of when you think of homelessness, there's a question, does homelessness cause health distress or mental distress, or is, there's a co-relationship there? And so the housing that you're in and the circumstance definitely has a big impact on health. And I think there's something to explore in terms of disparate health outcomes based on where you live, based on the types of amenities you have access to. If you think of access to parks, if you think of whether there's crime, you think of a number of different things related to where specifically you live. I think it definitely has health implications. In terms of technology and Twitter, I know there's a lot of different ways in terms of using new forms of data scraped from platforms such as Twitter and I'm learning more in terms of being able to capture this kind of real-time data in which you can learn more as opposed to, waiting on some of the other more official sources that are received with some kind of lag. And so I would definitely be interested in kind of exploring those collaborations as well.
Jordan?
I agree. I think my colleagues and I have very, I guess you could say, interworking interdisciplinary fields. And so I think one, even considering sort of the cultural aspect in healthcare and how, even health messages are sent and broadcast is super important, I think, to how health-seeking behavior takes place. And so working on projects like that would be important, or how certain tax credits I know that are offered to developers for certain projects, how those projects are sort of advertised to the publics that they affect. Because I think a lot of times in sort of gentrification situations, people think that they're going to be able to benefit from the new building that's being put there and then find that the rent is unaffordable or something like that. And so I think all of those things kind of mix in with how communication as a sort of infrastructure, as a institution, can affect these other policy areas.
Thank you. A movement is unfulfilled unless there are policies that follow. And so I would now like for us to open this to the audience so that they may ask questions. Thank you, Jordan.
Okay, it says, do either of you think there is something unique about your graduate program at Howard that prepares you to approach your research in a unique way? I think,
questions.
I see how I have this one right here.
Okay.
So I think that Howard definitely provides a space in approaching diversity and marginalized community aspects of communication that I think would often be a little bit more difficult to do without being kind of typecast in other institutions. And Howard also just provides still the very unique position of being in Washington, D.C., which only a couple of other universities can offer, along with what I had just said about the focus on marginalized Black and other intersectional identities. And so that's something that I definitely appreciate in what I do in my research here.
I would definitely.
Go ahead.
Yeah, I would definitely agree. And I think even within the econ space, there's a big reckoning, as there is in other spaces too. But in terms of race and a relationship with race, and the fact that, race and gender as well in economics, it's often, pushed aside and not really addressed or dealt with, or kind of like Jordan mentioned, kind of typecast. And I think being here at Howard, it's a freedom to be able to explore such questions and to not have it being dismissed. And I think that is so important, because even, having conferences, speaking with people from other universities, it takes a huge toll on you as a researcher, as a student, constantly having to battle different perceptions of you, whether or not you're looking at racial topics, but in general, your ideas, what you bring to the table. So it definitely has a big impact. And I feel like, I've had the benefit of being here at Howard and not having to necessarily battle those, other questions while trying to focus and put all my energy on my research. And so that definitely is a space that helps to thrive and to be able to do that research.
Wonderful. Marie?
I think, just echoing what my colleagues have said, there's a common thread where we're allowed to think critically about questions that we're interested in. I've definitely been in spaces where I've presented this research and folks just don't either understand or believe that racism could possibly impact the clinical encounter. And so Howard gives that space and that opportunity for students to really think critically about the ways in which race and racism and other social factors play a role within different encounters.
Thank you. We have another question. As someone who is interested in doing research in graduate school, what advice would you give to someone who never done research before?
I can take this one. I think the most important thing for me is finding a mentor who believes in your work or believes in your potential, and finding a group of folks who are interested in the same things that you're doing. And so you can learn different strategies on how to do research. You can learn about the research process, someone who's going to be able to walk you through the grueling process that it is. And so finding a mentor who's invested in your longevity, your intellectual legacy is super important.
I would add also attending events, I think, and hearing about research. I think that starts to help you think in a type of way for research, and it can kind of, spark a specific interest. Often, leaving undergrad, you have broad ideas of different topics, but, in grad school, you're really focusing in on like one specific area and topic. And so I think attending just different conferences and events will help you to kind of hone in on one area. And then by the time you make that transition to grad school, I think forming good bonds with your cohort, I think is really important in terms of, getting through and being successful.
I think kind of mixing in with both of those, I've always thought, sort of really getting in touch with what it is that you find interesting is super important. And I think a lot of times a mentor can help with that, or even attending events. But you need to read a lot, and you're going to have to write a lot. And so being sure that, this topic is something that you really sort of enjoy looking at and feel like you can do something with is really important, I think, because when the work stacks up, you want to make sure you're still doing a topic that you care about to kind of like push you through those tough times.
Yeah, I was going to also say the literature search is really, really important, because you're seeing what other academicians and researchers have done, and then you can think, well, I may have done it a little differently, but he didn't address this or she didn't address that, and that sort of informs the direction that you're going to take in your research. Do we have any more questions? I would like the panelists to ask each other some questions. Oh, okay, we have one right here. Have any of you researched how to avoid the typecasting that generally occurs when growing up Black in a predominantly Black neighborhood, specifically when a neighborhood is located in a low-income area?
So I would say I haven't done research that addresses that specifically, but being in communications, there is a lot of research, of course, about how representations of particular neighborhoods, races or genders are in the media, and the sort of importance in bringing out how those frames are kind of created. And so what I would say is not that typecasting needs to be avoided, but that the way in which we typecast in each other needs to be critically sort of addressed. So I would say, looking at, if it's in a sort of academic setting, looking at the professors or the administration and the way in which maybe the demographic of the staff or things like that might contribute towards the likelihood of particular individuals being typecast or discriminated against in any other way like that.
How about you, Bethel?
I haven't done any research in terms of typecasting. I guess I'm just rereading the question to see if it's more of a person trying to figure out how to deal with that space, or finding out what the research says. But if it's in terms of how to deal with such a space, I think in some cases to kind of address it gently, depending on a number of different things within the environment, because if you're in a school and it's something with a professor, sometimes it can be delicate, but figuring out ways in which you can sometimes bring it to their attention to get it reversed. But also I think having a support system is really important, because this kind of typecasting, persons can slight you in different ways based on their own perceptions. But I think, so one, addressing it on the external side, but also having that support community so that it doesn't impact you as much as a person, in terms of taking care of yourself, your own self-care.
Would you like to add to that, Marie?
Sure. I haven't specifically looked at typecasting in my research, but one thing I do is to be critical in the ways in which we use race. Folks, when you look at the literature, we kind of use race interchangeably. In some literature almost biologizes race, when we know, at least from the social science or from sociology, we view race as a social and power construct, right? And so when we were deliberate in our definitions, when we ask different research questions in a survey or in an interview, I try to be really thoughtful in the ways in which I'm using race, so that the message is clear. And when we're the goal is to write a manuscript, right? And so we can follow that thread and make sure it's consistent with the definitions that we use.
Well, since Howard University has the reputation of, I don't know how to say this, where we have a number of undergraduate students who are on Pell Grants, and U.S. News and World Report and some other institutions have said that we are one of the best institutions that bring people out of poverty and put them in the mainstream of middle class and upper class and so forth. So anyone who's feeling it as if they don't have a chance because they're in a low income area, some of our best thinkers have come from low income areas. Some of our most accomplished people have come from low income areas. So don't ever let anyone diminish or marginalize what your capabilities and your potential will be. That's my take on it. Would you all like to ask each other some questions?
I'm interested, actually. I have a question for Marie. I was just wondering what kind of research implications, or maybe even just sort of like literature that you've seen, as far as how maybe stigma or race have contributed during this this pandemic, basically.
Yeah, that's a really great question, and it's kind of like the important topic at the moment, right? We know that that more Black and brown children are dying from coronavirus, even though they make half of the population. And so we see how training and bias in the ways in which ventilators are distributed. We have to think about insurance status. So there's a lot of variables happening at play. And scholars like Hopkins at Georgetown, like right across the street from us, are looking at these ways. And it does play a role, and it'd be interesting to see what the trajectory will be from this new line of research that's coming out.
There's terms of gentrification. Oh, okay, we have something now. Due to our current political climate, it appears that races are more divided than ever, especially when examining social media. Across your research, has there been any notable concepts, theories, or practices you've come across to assist in bringing unity to our social climate? I think we're going to start with our communications person on this one. So let's bring Jordan in on this one.
Okay, so thinking about this, there are There are a couple actually that I think kind of address this in a lot of ways. So firstly, what Marie was saying, how it's very important to think about how we think about race in this country, where we've sort of, historically speaking, tended to break it down into a dichotomy of black and white. And that can cause a lot of problems when you have these simple categories like that. And so one theory that is very interdisciplinary, but is prominent in communications is intersectionality, which starts from the point of Black women and kind of shows how this dichotomous understanding of race or gender or either other social factors is really problematic for people that fit in between those lines. And I think starting there helps us kind of realize the ways that we all kind of have these different aspects of our identity that can oftentimes be used to create divisions or like othering between in-group and out-group people. But I think that's also what we need in order to understand and appreciate the differences amongst each other, and then create or use that to create connections instead.
From an economic standpoint, Bethel, can you address this question?
Yeah, so in terms of economics and the current political climate, you know, basically in terms of unity, we can think of equity, which is something that impacts everyone. And in terms of, for example, housing, if you look at just thinking about what would impact one person versus another, I think putting yourself in the other person's shoe is very important, because it's easy, as Jordan mentioned, to kind of put the other person in that other category. But when we just stop and, you know, look at the numbers, look at the facts, and think about the other person, just as we think about ourselves, it's easier to kind of come together and see, you know, even take a step back from the politics of it and say, well, how are these policies impacting other persons, and how would I be if I was in that same situation, as opposed to just looking, you know, blindly at the politics and not taking into consideration each person as a person. And I think sometimes in economics, you know, especially with averaging and stuff, we look at just numbers and kind of detach it from the person. And I think putting back that human aspect in it is important to bring us back to unity.
Okay.
I agree as well. Just from a sociological perspective, we have lots of theories that look at this, from historical materialism, critical race theory, and as Jordan mentioned, intersectionality. And in these theories kind of help us address the social factors that dictate everyday life. But I think it's also important to really challenge ourselves to work collaboratively across disciplines, kind of like what this panel is doing today. We know that research is more innovative when different perspectives are brought to the table. And so while there is a lot of political and social divide now, it really takes a great effort for folks to be honest and to really start thinking about how to make change. And so like right now, everybody's focused on anti-racist work, but what about anti-discrimination in gender and sexuality and in religion, right? And so once we are able to get to that place of honesty, which Bethel was talking about, and humility, and really thinking about these questions critically, then we can really get down to the root causes of these issues and start building change and becoming change agents, because it seems that most folks are interested in the same thing. It's just the perspectives are combating. And so if we can come together collaboratively and think about what we can bring to the table, then we're able to become change agents in that way.
I think we need to reform education, because I think history has to be factual. It cannot be based on the conqueror. And I think if everyone is reading the same truths, that will bridge a lot of the problems that we're seeing right now. That's just my take.
I think kind of just going off of that, Dr. Jones, I think some of the ways in which sort of thinking from, this aspect of media, some of the ways in which we're taught outside of the educational system as well, I think would be really important. So kind of critically looking at the ways in which, certain passive media like television or things like that, the sort of messages that they're sending and what we're taught is sort of, leadership or right or wrong, things like that, and outside of the educational system.
Okay. Well, would you all like to make any closing statements? I want to thank you. You were a great panel. And I would like to hear some closing remarks from each one of you.
I guess I would just like to thank you, the organizers, for putting this on, because it's so important. We've had this momentum of protesting. I, went out and marched as well. But we also want to get, things on the table that will kind of crystallize the kind of changes that we're calling for, so that it's not a one-off change in response to what's going on, but we can get changes in the status quo that will have lasting impact on multiple generations. So I think it's definitely important to link the two and get that policy done.
Okay, Marie?
Same as well. Just want to thank you all for this opportunity. I think as graduate students, we're kind of placed in these academic silos where we focus on our work in our own respective fields. This was a really great opportunity to work with other students in different disciplines and get to hear about their research and ideas for potential collaboration.
And how about you, Jordan?
I agree with Maria, especially with the pandemic and things like that. It feels like all I am is here with my books and me, and then but yeah, I definitely want to thank everyone for the opportunity, and talking and working with Marie and Bethel has been very interesting, I think, and I just want to emphasize kind of like the whole importance of the panel in thinking about how policy affects our day-to-day lives, and how it's important for us to make our protests and things like that known, and it's also important for us to put ourselves in that policy arena so that we can kind of make that direct change if no one wants to listen.
That's when the movement is solidified, once we have the policies in place to affect change. So I want to thank my panel. You all were excellent. It was wonderful seeing you face to face, sort of virtually. I would like to thank our Miss Jamisha Relaford. What do you call the controller or whatever she's called? We want to thank her for her service for this panel. And I guess if we don't have anything else to add, I guess we're done. Thank everyone for joining us.